So, a day in the life video, yet another one. We did one pretty recently, which I hope you enjoyed, and I think it did show quite a lot more than my day in the life videos usually do, namely because we were actually allowed to go back on campus, which is very important, and yeah, I've tried to do another one. Now, I haven't done another day in the life video at my university because why would I do two in a row, but I've done one on my placement. I'm currently in my second year of Imperial College London, and so we have two placements during year two. We've got one placement during year one. Now, our two placements during year two are during the autumn and spring terms, whereas our one placement in year one is in the summer term. The importance of these placements are obviously to gauge more of an interest and sort of gain more of experience in what a hospital's like, as opposed to actually doing anything and learning stuff. That's more for third year when we actually enter our clinical years. Each placement is about 2 weeks. We don't know a lot of medical knowledge yet, so we can't really provide too much to the team, but we are there just to listen and sort of just absorb stuff. We're essentially like a sponge, which is a interesting term. My placement this year was at Vascular Surgery. Now, for those of you who don't know what vascular surgery is, it is probable that you've heard it used in conjunct with cardiovascular surgery, and that's right, it stems from cardiovascular surgery. Vascular surgery essentially is to do with the vessels of the body, so the arteries, the veins, the capillaries, any problems that arise there, normally due to some sort of blockage or occlusion there, that's dealt with the vascular team. Normally, most problems tend to happen in the legs, so you tend to see stuff like ALI, CLI, which I'll explain later on in the video, as well as varicose veins, which are, a leg localized problem. You never tend to see varicose veins elsewhere in the body. You can see occlusions elsewhere, but it tends to be more common in the legs. Now, I was placed at Northwick Park Hospital again. Actually, to be honest, I asked for Northwick Park Hospital because I live very close to it, and yeah, nobody else kind of wants it because most people live in Charing Cross for university. I live at home, which is near Northwick Park Hospital, which is kind of nice because nobody else wants Northwick Park Hospital because it's so far away, but it's pretty easy for me to get there. I'm going to be basically filming as much as I can. I'm in a hospital, guys, so do be aware that I can't film loads. Obviously, I didn't film wards and walking around the hospital because that's pretty inappropriate. There are a lot of patients everywhere, so you tend to not be able to film as well. But I tried to film, when I was away private, when it was only me in the room and just, sort of summaries of what happened during the day. But yeah, I'm going to be sort of zipping between footage at the hospital and footage here, so I can explain stuff in more detail when I'm here, when I've got more time. And yeah, let's just get straight into it. So usually, yeah, like I said, I do wake up pretty early. I've got to get in. For surgical placements, you tend to have to be there by about 8, 7:45 probably. And for medical placements, you've got to be there for about 9 o'clock. The reason for that is surgical placements involve surgery, so most of the surgeons like to do their ward rounds and their meetings in the morning before surgery starts at 9. So it starts pretty early. Medical wards, which are essentially wards like infectious diseases, stuff like cardio, stuff like hematology, they are all medical wards because you don't see much surgery going on there, so they tend to meet at 9 for their ward rounds because they just get straight on with their ward rounds. So yeah, I had to wake up at about 6, which is kind of okay for me. I normally wake up at 6 anyway, but yeah. Right, so I'm vlogging here in Vlogmas one more time because it's my final day on the unit. So on the vascular unit, we are here today as our last day because tomorrow we have a debrief session with some clinical teaching fellows, essentially where we just feedback what we've seen in the last 2 weeks, anything that we enjoyed, and get some sign-offs as well. It's not too long, it's just a little session. We don't go to the actual unit as well to do that. We go to the education centre, which is very close to where I am now, the locker area. So yeah, we go there, we do some stuff there, we chat for a bit, and then we're done with our placement. We're on our Christmas breaks, which is really nice. This was an incredible placement, really. This is probably one of the best placements I've done so far. I haven't done too many, but this is probably one of the best ones. It's surgical as well, so I got to see a lot more stuff than I would on a normal placement. Right, so I'm currently in the vascular department / area, but yeah, we saw a clinic, which was pretty cool. A lot of patients coming in with stuff like other problems. A lot of patients with neurogenic problems or spinal problems that just get sent to vascular because they want to clear out any possibilities. A lot of patients coming in with varicose veins, so I've got to see some blood flow labs, which is essentially where you get patients and they come in and do an ultrasound of their veins to check that there's no deep venous insufficiency. Essentially, that's just when the veins valves, which essentially stop blood from moving back down the body instead of going up to the cardiac system, don't work properly, and you get blood that refluxes downwards, and that can be a problem, especially for patients who are elderly, because they can get really bad legs and they can't use them properly. It can be quite irritating. So that's one problem with that. Could you go to the next bit? Okay, so I just saw essentially a couple of veins treatments. So if you don't know what that is, it's essentially a treatment for varicose veins. But the premise was that it's essentially a treatment that helps to collapse those superficial veins so the blood can be rerouted through to the normal deeper veins. So yeah, saw a couple of those. I believe I am heading to the OR in an hour, which should be interesting. I've never seen that before. I don't know what I'm seeing there, but I'll fill you guys in when I get there. Well, obviously I won't be filming there, but you get what I mean. So yeah. Okay, so today's the last day. I didn't vlog coming in because you guys probably don't want to see the locker room again. So I'm currently in the unit again. I've just seen another clinic, which again is pretty much, I think we saw one case of CLI, which is critical limb ischemia. Essentially, it's where you get a loss of blood flow to the lower limbs. Can be caused by a lot of things. Usually critical limb ischemia, I think it's due to things like thrombi, so a blood clot that forms, usually because some of the fat that's usually blocking the artery breaks off. When fat breaks off, it exposes collagen to the blood. When collagen gets exposed to the blood, it basically goes into immune response, platelets form, and that blocks off blood flow completely. So it's interesting. It's not the fat really, it's more the immune response to the fat breakage that causes the critical limb ischemia. And that patient has to go through tests now to determine whether it is actually critical limb ischemia, and then obviously treatment will follow, and probably some sort of intervention. We also saw a lot of varicose veins, and today actually a lot of aneurysms. So most of them were, actually all of them were true aneurysms, had no false aneurysms, which are essentially not when the artery dilates, but instead when the wall of the artery tears and you get sort of a false lumen. I'll put a picture on the screen because it can be quite hard to understand. But yeah, we didn't see any of those, just true aneurysms today, which in a way is good because I think the false aneurysms are the worst ones. So yeah, good for the patients that they were true aneurysms, at least when they're getting the necessary necessary sort of repair that they're going to have. And yeah, there are no patients for the time being, so I'm just going to take a break, 20 minutes to half an hour, go back and check if there are any patients. If not, probably call it a day. And yeah, go do some revision and catch up and work a bit. Okay, so I just watched my first surgery, which was pretty crazy, but it was an amputation for, I can't remember what it was for, but it was just an amputation of the, I believe it was left lower knee sort of area. So it was pretty cool, very cool in fact. Obviously I can't say the patient's name, and I'm trying to avoid all patient confidentiality here. But yeah, it lasted about an hour and it was pretty cool. We got close and up to it, so we saw the muscles, all the tissues, all the vasculature. Since it's vascular surgery, that's pretty obvious, but yeah, it was pretty cool, and yeah. Okay, so a quick explanation of these terms that I've been using. So peripheral artery disease is essentially a condition that occurs when your arteries normally in your legs are blocked. Now it can happen elsewhere in your body, it can happen in your arms. In fact, I did see a patient who had peripheral artery disease in her arm. So normally we see them coming in with either clots that happen in their popliteal arteries or any of their tibial arteries, which are lower down in the leg. It can happen higher up in their femoral arteries, but we tend to see it more lower down. Now PAD, or peripheral artery disease, is a umbrella term for three other diseases called acute limb ischemia, chronic limb ischemia, and critical limb ischemia. Now acute limb ischemia is usually limb ischemia that happens acute, so pretty much acutely just means suddenly, and it's normally not caused by things like atherosclerosis. We tend to see it more as an embolic. So an embolic cause is essentially when a clot elsewhere in the body has broken off, travelled through the arteries and got stuck somewhere, and a thrombus essentially is where you get a clot that essentially forms at the site of the pain, and obviously that's very bad news because it can cause cell death and gangrene, and as we all know, gangrene leads on to sepsis leads us to think amputation. So we want to avoid that as much as possible, and as a result, acute limb ischemia is normally a surgical emergency. Yeah, pretty crazy. I think it's about 3 now, so I'm going to try and make my way back home so I can do some research on something one of the surgeons asked us to look at called polyarteritis nodosa, and essentially how many of them go into ischemia, which is something I don't know, so we need to go and do some research on that, and also try and chill before we come in for the next day. So yeah, this is everything really. Okay, so I'm going down at the moment, back to my office to collect my stuff, and yeah, call it a day. So it's been a pretty cool day, seeing a few different things. Clarification. So normally we spend most of our days at the hospital. Now normally what tends to happen is the later you go, the later you stay there, or the earlier you go, the earlier you leave, just because we tire out earlier. So, you know, the days that I go in earlier, I tend to come home a little bit earlier. So for example, on this day I came in at about 7:45 and I left at about 3:30, which, you know, is probably standard time for leaving, but some people tend to stay until 5, some people even stay until like 5:30, which is quite late, but that's normally people who tend to go in later. So yeah, it's kind of flexible in a way. All that matters is that you actually turn up every day, so you do need to go every day and check out things to make sure, you know, you're going and engaging yourself. And yeah, that's everything, I guess. I can't really think of much else, and I filmed as much as I could, but yeah, hope you did enjoy the video. Hopefully it gave you an insight into our clinical side of medicine. The last video is probably more preclinical. This is probably more of a clinical video. So hopefully you did enjoy it. Hopefully you learned some stuff along the way about vascular surgery that you didn't know before. And yeah, if you've got any other ideas for future videos, by the way, please do let me know. I'm always open to suggestions. My Instagram's down here, so you can just literally hit me up and let me know there. And apart from that, I can't think of anything else to say. So I'll catch you all in the next video.